of these old days. One of these old days. And we won't.
What's up, everybody? We're back for episode 46 of Transitions from War podcast. This is Mike, and we're talking once again about reconnecting to mind, body, and spirit. We got an awesome part 2 today, like I promised. Dr. David Lunow back on the podcast. We recorded this the same day, but broke it up because we had a lot to get into. And today's episode talks a lot more about sleep, about eating. And we realized, even at the end of the conversation, there's just so much more to talk about. You know, when you get a chance to talk to an MD, a doctor who knows the science behind what's happening and is treating patients based on that science and helping people achieve real results, I was just stoked to really get into things and ask questions that I knew he'd have the answers to, and I knew he'd have some backing to these answers, not just guesses. So we were really lucky to be able to talk to him for so long. We're going to have him back on. So everyone, I'm just excited to have you back here listening to the show. Glad to have you back with us. And, you know, for the first time, probably in the show's history, I have a backlog of episodes coming out. We got some really exciting things coming out in the next few weeks. So, speaking of you guys' support, I wanted to read. We got some feedback on the podcast. Or if you can, go ahead. I know you can subscribe and leave us a review, whether it's on iTunes, Stitcher, Google Play, any of that stuff. But our latest review comes from Gil Sandman 2, and he says, "Mike is a joto, and I support his right to love whoever. Great podcast." Thank you, Gil Sandman 2. I know who you are, so órale, carnal. Anyways, we got some sponsors to thank, so let's start out with our longest time sponsor, Cowboy Crickets. Sustainable Montana-raised crickets. You can get them in cookies, you can get them in powder form, you can get them in whole roasted crickets. Go ahead and check out this site. Go to cowboycrickets.com. Use the promo code VETS, VETS. Even if you're not a vet, you're supporting vets. Doesn't matter. Type in that promo code. Save yourself 15% on all orders. And, of course, Fireteam Whiskey, which is an app-based personal fitness and nutrition service geared to help active duty and military veterans take charge of their health with a ketogenic approach to eating and a high-intensity interval training approach to working out. Captain Stephanie Leakin has just launched something pretty cool, an app to get this shit rolling. So you can save 40% on all training plans and coaching with the promo code TRANSITIONS. This is all on the show notes. If you don't know how to spell transitions, you might be a fellow Marine. Alright, everyone. I'll have some other news coming up soon about some fundraising we are doing. I'm raising some funds for the Ironman Foundation this year, and if you'd like to donate, I'll have a link to how you can do that. I'll be carrying flags once again for Gold Star families, and we've actually launched this to make this a national initiative. So we're going to have vets in different races, different Ironman races in California this year, all carrying flags for Gold Star families, in some cases racing with them. And one of those Gold Star families we're going to have on this podcast, if not all of them, talk about what it's like to be able to grieve through sport. All right, everybody, I'll stop running my suck. Hope you guys enjoy part 2 of this episode. Yep. So part 2 of the episode, we've relocated into Studio B, aka my Tacoma. It was getting a little crowded with some people walking by in the health club we were in. But we were talking, we're going into sleep and different types of sleep. And I think we left off saying just some people aren't able to sleep and they don't want to because of the dreams they have.
Right.
And I remember thinking, after doing a few retreats with vets, that almost to a person, they would say, during these retreats, I've got the best sleep I've ever had since I've been out of the military, for a lot of them.
While they're on the retreat.
Okay. And I started thinking, it's like not we're doing some mystical work with them. Yeah, we're doing stuff. But even on the ones where people are just hanging out, ones where we had a swimming pool and we'd be shooting clay pigeons and just, hanging out.
Doing guy stuff.
Yeah, doing guy stuff. There's nothing like clinically significant about some kind of weird, intense therapy stuff.
Right.
But then it came down to, I realized it's the trust that comes in. People feel safe around other vets or other people they know would have their back. Yeah, so that perceived safety.
It's their safe environment.
Right.
Yeah, exactly. Because mentally you're like, all the little guards you put up in any other scenario, you can just relax and let go.
Yeah, exactly. And so there's something to be said. I think that we could find out how to adapt that to people's living situations. Not to say that people are going to live back in a squad bay with a bunch of people.
Right.
But just knowing that gives me a lot to work with when I talk to people about safety and the issue of, being aware of your body. Being aware of the physical signs and symptoms that you're experiencing.
Right. But there's another part to sleep as well, is the ritual that you go through before you go to sleep.
Yes.
And you have to have a ritual. So you're telling your body, hey, it's time for sleep. It's not time for anything else. And do the same thing every night. It's just like you go to the bathroom the same time every day.
Yeah.
I mean, and once
it gets the body ready for it.
Once you travel or something, your whole system gets thrown off. So we are very schedule-oriented kind of people. And so for proper sleep, obviously you need to have everything else metabolically and medically taken care of. But psychologically, you need to tell your body now it's time to sleep so your body will actually relax. And then, of course, the environment, you're in. I can see why, when you're with a bunch of vet friends and you're on a retreat and that's your safe space. That's completely understandable. Trying to replicate that, though, at home then, in regular life, that's where the trick comes in. Now, yeah, I can as a doc help you medically if it's required. I would rather not do that. I'd rather you do all these other types of things to see if you can get good sleep without me having to drug you to sleep. But some guys are so sleep deprived, they may need that for a period of time until we can get everything else regulated, and then we can take them off that kind of medication.
There's something that I think that goes into that. So obviously not practical to say to someone or prescribe them, go live with, 8 guys that you were in the military with, have them relocate from around the country. And I remember that there was one point where I was training up for a Go Ruck Heavy. So it's this 24-hour endurance event where you just carry a bunch of heavy shit. And as it got closer to the date, like maybe a couple months out, I was just racked with anxiety. I was just racked with it, and I couldn't figure out why. And a couple things helped. One was a friend that said, "Okay, man, hey, we're both doing this, man." Because I told him I was thinking about backing out because I didn't know if I was trained up enough, and I was just basically trying to puss out of it. And he's like, "No, man, just push the dead side. We're going to do this." But so I'm meditating, and this is the only time I've had this big epiphany during meditation, and something just clicked where I knew, oh, all this anxiety is leftover war stuff. And so that knowledge was enough to let me get some distance from that anxiety to say, oh, this makes sense that it's there. It's leftover war stuff. And so instead of saying, oh, I'm anxious, and then I thought, I found that feeling of anxiety, then my mind goes, why am I anxious? There must be something wrong. And then I have increased anxiety, and then it kind of spirals out of control. So
it's like a trigger.
Yeah, exactly. Basically. And so maybe the knowledge that people are feeling unsafe or not able to sleep because of that can help people adapt, I guess, just their response to that. And so it doesn't ramp up, the increased resistance to wanting to sleep, just that body awareness. Oh, okay. Yeah, this is leftover war stuff. And maybe if I do some breathing or some stretching or something like that, I can get better sleep. And so it stays at a certain level.
Yeah, that's interesting. Yeah. You've mentioned meditating quite a bit, and I remember I texted you one time that that's not something that I've ever done, and it just sounds so new agey or whatever, kind of stuff. Even though, this has been a common practice for millennia, it doesn't necessarily have to have a religious connotation to it either, which is, I think, where a lot of the resistance comes in. But talk about your experience more with this meditating and helping you de-stress through meditating.
Yeah. Well, it's interesting too. And before, when we're having coffee talking, we're just talking about kind of the culture of where I live out here in Northern California, where, people grow up and like my daughter's learning about, deep breathing and meditation as a 4 and 5-year-old. And so that's a normal thing. But I know that there's just huge, like perception of it being like I think of, like Tibetan monks,
right.
That's why they do that. It's a Buddhist or a Hindu or some Eastern kind of practice. And there's a lot of resistance to it. I think stepping outside of that, if we had a different word for it or just called it deep breathing, but it's essentially stepping back and observing the fact that your body has certain sensations and feelings and emotions and that your mind experiences different thoughts in it. Because when you can witness that your body is having a certain reaction, then you can say, oh, okay, this isn't the totality of my experience. I'm not just in this chaotic state. You can see it for what it is. So you have kind of an outside perspective. It's like, you're the commander of the battlefield and you can see the different parts of where they are and say, okay, let's make these adjustments.
Yeah. But you know how foreign that is for most guys.
Oh yeah, completely.
We are so out of touch with our bodies, or our actual mental state either, and so to have them to step back and actually examine themselves, and that, is asking a lot. I think like here it's common practice probably in California, at least the concept is, in Texas, it's like get some friends and sit around a campfire drinking beer and then shooting the shit,
Yeah.
It's more of okay, this is where a man feels most comfortable. But in that environment is still a macho kind of environment where guys were not going to be vulnerable.
Right.
Yeah. And so, and this kind of thing really is. But I think it's incredibly valuable for actually to process all these things, is to sit down and examine, why do I feel that emotion, fear, anxious, whatever it is, and start getting behind it. Because, our feelings are just a symptom of something much deeper that's going on in us. It's just our body's reacting to it that way. Figuring out why you're reacting to it is actually the core of addressing it. Yeah.
And then that's, I think, kind of hits it right, coming full circle of this conversation. We're talking about what are these root causes? What's really happening versus like trying to patch up, Band-Aid problems that's not going to stop them. It's just going to be a temporary fix. And I think it's too, like when guys hear about anyone talking about feelings, emotions, breathing, I remember the first time these things were floated by me, I just thought of, the stereotypical female therapist that has, like colorful scarves and like earrings from somewhere in Africa.
Yes,
maybe,
exactly.
And just like, very like just airy fairy kind of stuff. And then, it reminds a lot of guys too of maybe their partner or spouse saying like, you never talk about your feelings. And it just sounds so foreign to the male experience.
Yeah.
And
absolutely.
So of course you'd want to resist it,
Yeah.
So sometimes I flip the script and be like, all right, man, maybe you're just too much of a pussy to meditate. And it's interesting to see people's reactions.
Yeah.
Like, what? No, I'm not. Wait,
Challenge like,
what's
what?
happening?
Your vagina hurt or something?
Exactly.
Give them a hard time. Throw it back at them.
Yeah, I guess if you're a little bitch, you can't talk about your feelings. Yeah,
Exactly.
if you want to see someone's head start spinning.
Exactly.
But I mean, to see it in the context of how it makes sense for a man to do that versus a woman helps out a lot, because as a male, we don't want to just do things exactly like a female. We want to understand, okay, how do I get in touch with my feelings as what is contextually appropriate for a man, which is going to be beneficial. Because the other perception is when people come into therapy too and talk about feelings is that I'm going to completely take away any kind of masculine traits, and that we're going to go around wearing sandals and talking about our feelings and crying all the time.
Yeah, exactly. Well, which is why I would resist it. There's
exactly.
nothing more emasculating than that, except for maybe 11 a.m. on a Sunday at church. Which is my own theory about that. But as a side, just think about it. church is geared towards women.
Right.
And to ask a guy to go to church when the whole scene is set up, you got mood candles, you got mood music, you're singing love songs to a guy. The only reason a guy would ever, submit himself to that is because he's trying to get laid. And then and yet we've set up this whole culture where that, so who goes to church? It's women and effeminate men. Who avoids it like the plague is lesbians and real men, because of the way we've set it up. But anyway, that's an aside.
That's a really interesting note. Yeah. Huh.
But this is similar. When we're asking a guy to talk about his feelings, A, he doesn't have the vocabulary to, because he's never even tried to describe his feelings, and two, it sounds very gay, so to speak.
Right.
And so you're going to you have to sell it more of a, in a context of a man, what would appeal to a man. And I think in my mind, it would be like control, where you're able to process and control yourself.
Yeah.
And so, but you have to understand what's going on first. And this is why we do it. But, like most guys, the reason why I want to talk about it as well is because they think, well, I'm not crazy. So they resist. Yeah. They resist because they're in their mind, the implication is that I'm asking you to talk about your feelings because you got a psychological problem, instead of, no, this is just a normal being human,
Yeah. And that separation of mind, like psychological and physiological, it gets really weird. Like your guy coming in for back pain when, that was the socially acceptable way to come in.
Exactly.
And so it's not good to have anything wrong with your mind or your psychological or your thinking process, but it's okay to have, a fucked up back or a knee.
Right. Right.
So it's interesting because like when I'm talking to people and I try as much as I can to normalize and say, there's nothing really wrong with you, saying that there's nothing wrong with your psyche.
Right.
It's, you're having the exact appropriate reaction that someone would be if they were in combat or in, a life-threatening situation.
Right.
And so your body's reacting accordingly. What can we do to help your body learn that it's no longer there because it's reliving that? And that I think helps people have a different perspective of trauma and PTSD.
Yeah. Yeah. Well, it's like, as a physician, when I've worked with a patient for a problem and find there's nothing wrong with them, a lot of times the patient's not happy.
Yeah.
Because they actually want a diagnosis. Oh, thank God, there's something legitimately wrong with me. And I remember I had this little lady to come in and she was short of breath, whatever, and she'd not seen a doctor in years. And I woke her up and she had this huge lung cancer. And I was, I had to give her bad news, obviously. But I was so surprised at her reaction. She's like, "Thank you, doc. I knew there was something wrong with me." And she was relieved to finally have an actual diagnosis for the symptoms she'd been, experiencing. And I was sort of a little taken aback because she was relieved that I just told her, "Hey, you're going to die from this at some point in time," But I had to step back and think about it. Yeah, when you don't know what's going on, that's the most fearful inducing kind of a problem, And if you have something mentally going on with you, when I can come as a doc and say, it's not your mental, it's because your testosterone's in the toilet.
Right.
Let me fix all this. That's a huge relieving thing. There's something that can be done and I'm not the problem.
Right. Exactly. And that translates so well, or segues so well into talking about trauma. Just like someone who doesn't sleep for 3 days will have, visual auditory hallucinations.
Oh, absolutely. I see that all the time.
Exactly. And people are relieved when it's like, oh, if you can offer, if it's because of lack of sleep or this or that. Because I think the alarming thing for people is when they can't trust their senses. And that's essentially what trauma is. You're getting sensory input. You're getting symptoms and things showing up that's from a past event, and it doesn't match the situation you're in.
Yeah.
And so people worry, oh, I'm crazy.
Yeah, because you don't immediately take those emotional reactions to that event a couple of years ago.
Exactly.
Or even further back in the past. You don't correlate them until someone actually can correlate them for you, and they're like, oh, suddenly the light bulb comes on. You're like, oh, I'm not crazy.
Yeah. And I'm laughing as you talked about the woman who is, relieved to have cancer.
Yeah.
Is in the same way. So 2 years ago, I'm training up for my first Ironman. And, I get this really tremendous lower back pain and pain in my midsection. And I go in there and I'd been to the ER a few times for some, I don't know, this is weird somatic stuff. And they just say, I don't know, I don't know what's going on. And I was like, fuck, maybe I'm just a big puss. And so when he told me, yeah, you have appendicitis, I was like, oh, thank God.
Exactly.
Yeah. Thank God I have appendicitis and I'm not a big puss.
Exactly.
So
You just don't have gas.
yeah, exactly. It's the ego showing up, and it's nice to know that the sensory input that we're getting, it matches something that's happening, and it's not just something my mind is making up.
Yeah, exactly.
Biggest relief.
Yeah, that is the biggest relief. Yeah. Yeah, you have appendicitis.
Right.
That's funny.
Well, so we've talked about sleep. We've talked about dysregulated hormones. We've talked about what else kind of things are you seeing in the trends with vets?
So this brings up more of a deeper, awkward conversation. In that, we've talked about some sexual dysfunction, but one of the things that everyone has told me is that they feel emotionally numb a lot of the times, and across the board, either pornography, masturbation, or risky sexual encounters seem to be fairly common. And as I've been able to pinpoint it, they've said this is what makes me finally feel alive and normal inside. And so the dysfunctional way that we are trying to feel normal, I've been reading up on it and trying to figure out exactly what's going on there. One of the guys said, he would try to entice whatever girl he happened to be with. Let's have sex out in public, and there was always this potential risk of getting caught.
Right,
heightened the experience,
like a danger,
the danger component coming into it.
Is this an adrenaline thing?
I think so, because nothing else matches the adrenaline rush, which you have like a constant stream of almost in combat.
So this is just a different way of
doing it. Yeah.
Yeah. Like people who ride motorcycles way too fast. This is just a sexual way to do that.
And a lot of them do those kinds of things as well.
Yeah.
Risky, all that kind of crap. But what that really gets them, and the reason I think it is because in some of the neurologic studies, the three components of the brain that are affected by PTSD are also the same three components where you experience sexual arousal and orgasm.
Interesting.
And it involves the same set of receptors: dopamine, serotonin, and norepinephrine. And they get dysregulated in combat because it's always a constant norepinephrine, the fight or flight type of thing going on. And so, but in the sexual encounter, you need that side of things, but you also need the parasympathetic side of things. Sympathetic gets you up, and parasympathetic gets you off. Basically, is how it works. But there's a huge dysregulation in their brain because of PTSD in combat, and so they need more extreme types of sex, I guess, if you want to put it that way, or types of experiences, or pushing the envelope. Some guys even have delved into all sorts of other types of sexual experiences. A couple of guys have talked about them that they would never normally have ever done.
Right. It's just like it's out of a need for like this. This level is not enough. I need something that's kind of scary.
Well, and you think about the progression. When you were a 12-year-old, holding hands with your girlfriend, you got a boner.
Right. Yeah.
And then and now you're 35 and you can't get it up for Miss February or anything. And so it's like sex has this either it enhances you or it has the ability of diminishing returns. And the problem with combat and the amount of stress is that it's diminishing returns. And so until you find some healing and some processing of that, and then it becomes more of a life-sustaining and life-giving type of endeavor. But also because it involves those three areas of your brain, it can trigger terrible memories because those are what involve from your trauma, from your combat experiences. And so people then tend to either avoid for a long period of time and then suddenly explode sexually, which seems to be more of the common experience from the guys I've talked to. And so that's something that you all, in the psychological side are going to have to sort of evaluate and figure out.
That's interesting. It makes a lot of sense. And I'm really surprised this is the first time I'm hearing about this, but it's one of those things that seems so obvious that once you hear it, it's like, of course, how did I not know this before?
Right. And I just sort of came across it because my friends we were talking and, we were talking about sexual dysfunction and I was trying to see how I could help them medically and stuff. And so, I just threw out some questions out there just to say, well, what are you actually doing? And a couple of the guys, I have to give them kudos, had the courage to actually just tell me straight up what they were doing, which I tried not to register shock, on my face. And I'm not a poker player because my face registers everything.
Yeah.
And so, but we were friends, and so I loved them, and they were my friends, and so I wasn't going to judge them for this, but I was just like, what's going through your head when you go do this, And so then I started reading up on it, and actually I had a study that I have in my car. I should have brought it with me, but a study that's actually put out at the VA. There's some doctors that actually started doing a study on this and trying to figure it out, where they were doing a bunch of other things, like they assessed, the amount of erectile dysfunction among vets, and this like between 60 and 80% of vets coming back have erectile dysfunction.
Wow, yeah.
And arousal issues.
And that matches like what I'm seeing on the charts when I'm looking at the medical records for the people I'm seeing, is like a lot of them are being prescribed Viagra.
Oh, yeah. I mean, that is once they know that I'm willing to do that, this is the number one thing they want to get to.
Yeah, exactly. Right.
When we talk about, I'm trying to make sure that they don't have other medical reasons that are causing the problem, but.
Well, it's like they said in Donnie Darko, if you don't have a dick that works, what's the point of living?
What's the point of living? Yeah. Well, exactly. I mean, and that's every guy. I mean, our identity revolves unfortunately around our penis. So,
and you have that. I mean, it's in war movies, and I heard it like a bunch of people saying like, if someone gets shot, they'll always ask the doc, "Hey, is my dick still there?"
Is my dick exactly?
Like they could be bleeding out the femoral artery.
Yeah, who cares about the leg?
Yeah, exactly.
The dick still, exactly. Every guy can identify with that. I mean, that's just how we're wired, partly. But it was interesting to get into the neurologic issues and why that may be happening. And so you have to step back. Yes, I can give you Viagra, or I can even, if you can't get up at all with any of those meds, I can give you a shot, Alpracidil or something. You can give a shot, and you'll have an erection whether you wanted one or not. And depending on how much I give you as to how long it'll last. So there's always something that can be done to at least get you up. My concern as a physician is what's behind that, and if we can fix the actual causative problem, then we won't need to do all the rest of this, up front.
Yeah, it's like if you have if you're pulling weeds, you make sure you get the root out.
Exactly.
So, or else it's just going back, a couple of days.
Yeah.
So
exactly.
Eventually I want to get to, what can people do, like who are listening to this, who identify with some of these problems, and they're like, oh yeah, you guys are talking about me. But first I'm wondering, this kind of leads to what's being missed, let's say, in the mental health and the medical community. Why are these things getting missed?
Okay. I mean, I have my own theories. I suppose there's not, studies out there that say why it's being missed. There's a problem in American medicine and healthcare. There's a lot of cracks, and certain things fall between the cracks. Like a primary care doc is going to focus on, disease management. And if you don't have much of a disease, you may just have some erectile issues. Well, I'll prescribe Viagra or something. Go see the urologist. The urologist is going to do an exam and say, well, physically you're completely normal. You got normal blood flow, the Dopplers, blah, 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 on your penis will tell you the normal blood flow, et cetera. It's psychological. They're going to send you to the psychiatrist who doesn't know what the hell to do with it. Like, well, you're a physically normal person. Why are you here? And so all these and so no one actually does any type of hormonal panels and all that kind of stuff to figure out, is there an actual medical problem that I can treat? And so it's just disjointed. And so my recommendation and my challenge to primary care is that get your act together. You need to fill in all the holes between all these subspecialties. And this is why the top half of the class in med school should go into primary care, and the bottom half should go into the specialties. Because, you can teach a monkey to do surgery, but to actually cognitively put it all together and work with the patient, because it involves more than just medicine. It involves psychiatric, it involves, emotional, it involves a bunch of other stuff, it involves lifestyle, everything else, health and nutrition as well, to get a fully healthy individual.
So if we could have people meeting with their primary care doctor, just getting more of a workup and more of a broader history.
Yes, absolutely.
Then they could be appropriately, referred to specialties if needed.
Right. But the problem is that every primary care doctor is under mandates. You have like either 15-minute blocks or half-hour blocks. So you can only get so much in.
Right. So they get as much as they can. And so it's more like just the system is set up.
The system is set up against it. Yeah. So there's two problems. The system, it will not pay a primary care doc to spend all this time, because we're going to send you the dietitian for the nutrition. Right. Go find some guy in the gym to give you a workout program, all that kind of stuff. Go see the psychiatrist for your depression and all your emotional issues.
I'm thinking of my VA doctor, and it was one of the most baffling experiences I had. And so I was probably 20 pounds heavier than I am now. So, I'm coming into the VA for just regular doctor, just regular physical, and meeting a doctor again for the first time.
Yeah.
And VA sometimes doesn't get the best quality doctors. And this nice enough guy, but it was hard to understand him. English was not his first language.
Yeah.
And so I'm talking to him. And first off, I come in on my motorcycle. So I'm wearing these heavy steel toe boots and an armored jacket, right? And then they just weigh me. And I was like, should I take off my backpack? They're like, yeah, I guess. And then I get on the scale
and you weigh.
I weigh 240 or 250 pounds.
Oh my God.
And then they just look at my BMI and they're like, I think you're morbidly obese.
Obese, yeah, exactly.
And I was like, should I take off my shoes or anything?
Yeah,
And
maybe I should stand naked on the scale.
Yeah.
Which you should, yeah, absolutely.
So, but everybody seemed okay with that. And I was like, am I fucked up or is this fucked up? And so I start questioning my reality. Anyways, I get there and he's like, oh, are you too fat? Just stop eating so much food. You won't be too fat. I was like, so that's it?
That's the answer?
That's like that. All your medical school and training brought you to this conclusion. Just, I'm too fat. Don't eat too much food and all my problems will go away.
See, okay, let me apologize for medical doctors everywhere. That's just a gross abuse of the position.
I mean, some of what he said was true. Like I was eating a lot of bullshit and that did, contribute into it.
Yeah.
But that's the general experience, is someone going into the doctor and if they have that experience, they're like, what the fuck am I here for? What are we really getting out of this?
Well, and especially most young guys, they're actually fairly healthy.
Yeah.
I go to the doctor if I'm sick.
Right.
Instead, we need to change the paradigm. I go to the doctor because I need to get all the dimensions of my life put together, and it involves nutrition, it involves health, it involves fitness, it involves medical stuff. So I have a plan.
So like being like seeking optimal health versus just disease management.
Exactly.
Right?
Absolutely. I mean, and that's where the paradigm shift has to happen and has to happen in medical education.
What can people do like outside of that? Because obviously people listening to this are going to say, okay, the people listening to this are more likely to take proactive changes in their life. So before they get to a doctor, what are some of the things that people can do in their life that'll have, like huge benefits, huge payoff?
In my opinion, diet is massive.
Yeah.
Is a massive pillar in your health. And there's a lot of great YouTube stuff on diet. You have to filter through a lot of crap.
Oh, that's hard. That's like...
Yeah, that's asking like you'd spend hours and hours every day.
Internet gurus, everyone has the perfect diet. What's your take on all these different camps?
Okay. Just at a huge global overview, I think the traditional American diet before, 40 years ago, back our grandparents' diet, they worked on the land, they raised their own food, and they ate it. And they were healthy.
Right. I was seeing footage of you might have seen it. It was like footage of, I think, New York around like the turn of the century, 1900s. And I don't think I saw one fat person and no one was doing
even
CrossFit.
In the 60s.
Yeah.
So think about the 60s, the picture, everyone was thin.
Yeah. No one's doing CrossFit. No one's doing intermittent fasting or keto or like any of this shit.
Well, our portions were smaller. We ate real food. So we were full. We ate real butter, so we were full. That all the things that satiate us, which we know satiate us, we suddenly, had this. There's been a political and big agra, conspiracy, in my mind,
subsidized
for sure.
corn stuff.
Exactly, and the amount of carbs and sugars in our diet is just astronomical in comparison to what back in the 60s. And then we went to this low fat. The problem with low fat is that to make it palatable, they have to have so much sugar hidden in there so that your body will it'll taste good on your tongue.
Right.
That they just sabotage your health left and right. It's like a conspiracy to keep people ill.
Yeah.
And it keeps the medical community in business, basically, And you rarely meet a primary care doctor that says, I'm going to be your doctor for next year. I'm trying to get you as healthy as possible so you never come back to see me. That's not what they're telling you.
Hey, and there's a weird codependency too in the therapy world. Yeah. So it's really there.
Yeah.
So it's like if you're eating food that is as close to its natural state, we're not eating. I mean, I have a bunch of these quote unquote nutrition bars here, and they're good stuff when you need them. Mm-hmm. But if that's your go-to, you're having a lot of food that's been processed, and processed is kind of one of those buzzwords, but it's much easier for your body to uptake all that sugar, and it's not bound to any kind of fiber or anything else that's going to satiate you.
Yeah. There are, So as the medical community, we're not in the business of healing people. We're in the business of managing diseases. So that's the number one problem. Then we've had this conspiracy and this, I don't know if it was an overt conspiracy, but it appears like it, to keep people fat and unhealthy,
Right. I mean, you can see the financial interest of people growing the stuff and
right.
the people lobbying for it.
Right. Which is why as a doc right now, I'm very pro about this, all natural foods and all that kind of stuff, farmers markets, all that kind of stuff. That trend, to me, is brilliant. It's great because it's in the long run, you're going to be much healthier that way. As far as diet information, my own opinion is that we're carnivores, basically. And I love the Paleolithic type of model. You've heard of the paleo diet out there. There's many versions of it. There's the keto diet. There's many versions of that. And then there is the real extreme carnivore diet, which you basically eat only meat. There's reasons for all these diets, why they came to be. Keto diet was originally invented so that, the seizure disorder patients, could manage their seizures.
Right. It was a medical prescription, right? Yeah.
But then they found out there's a lot of metabolic sequelae from that actually are very healthy. And so it sort of turned into a diet. I would like you to, I could give you some names and stuff for people that you could reference and read up on some of their stuff. Some of the better ones are like this cardiologist, Dr. Brett Scher. Has a YouTube site where he is a practicing cardiologist that gets all of his patients on the keto diet, basically, and he's having miraculous results with his patients.
Yeah, we'll link to these things in the show notes so people can check it out for themselves.
So it's some of those people that will give you the actual research, and actually they're not pushing anything. They're just telling what the research shows, what the biochemistry actually shows. One of the big things for me when I first started studying this was like, understanding that when you eat something, your body doesn't know that it's a cinnamon roll versus a steak. All it knows is that it's a certain type of food and it triggers a certain hormonal metabolic response from that food. And so, you go down certain pathways. It's basically a fat pathway if it's all fats, basically a protein pathway or basically a carbohydrate pathway. And then there's sequelae from that. So some of the people, that are sort of more middle of the road, they're like, start out with a protein. So you trigger your body, we're eating protein. And so your body's having this metabolic process. And then towards the end of your meal, you can add some carbohydrates in there so you don't have this huge insulin spike.
Interesting.
Which it makes complete sense. And metabolically, it actually works.
So it's almost like a buffer for that.
It's like a buffer. Okay. Yeah. Because, you've already processed the body and triggered the body to go this route. And so when it starts processing the carbs, it's not going to have such a huge response as if you just start out with a carb. So I'm personally, I basically eat meat with a few veggies here and there, and I feel full. I'm full, and I don't eat much. I have a hard time actually getting the amount of calories I'm supposed to have.
Very rarely in my life have I had that problem.
Have you had that problem?
Yeah.
But then, if I'm compliant that way, and my body fat's 8% now or something, I can have a pizza periodically. It's just that's not my main diet.
Yeah.
And that doesn't sabotage me. I don't put on pounds just because I ate a whole pizza. But then I'll feel sluggish and feel terrible after eating the pizza for a couple of days, and I realize my body's completely does not like that. You become much more cognizant of what your body's feeling like with certain foods. When you have an elimination diet, you just start with some just basic stuff. But there's some tribes around the world, 4 big ones, the Mamas in Africa. They basically eat meat and drink blood from their cattle. And they almost have no modern diseases whatsoever. The men are ripped. The men look awesome.
Is this the same as the Maasai?
Maasai, yeah. The Maasai in Kenya do the same thing. Exactly.
Wow, okay.
Yeah.
Cool.
And so, so some of these tribes, we sort of taken their DNA and started studying their stuff and all that stuff, which is leading to a lot of the research that's now going on diet and how that impacts health. So for what guys can do right now is study up on this and actually, clean up your diet. Get rid of everyone knows junk food is not good for you. Just get rid of that,
Yeah.
And then see how you feel. Now, you're going to have an adjustment period because your body's going to be, where are the carbs, damn it? And what interesting thing, that study I read, do you know carbohydrates attach to the same receptors in the brain as crack cocaine?
Yeah, exactly. You get that same response.
And it adheres harder than crack cocaine. So it's more addicting than crack, so to speak. So that's why you're in 30 minutes after eating a piece of pie, you want another piece of pie.
Yeah, exactly.
And that's just not counting the insulin response and all the other type of metabolic issues that are going on.
Well, think of anyone who stress eats, and I can relate to this for myself. If I'm having a shitty day and the route I choose, to go down to deal with the stress is to eat something to make me feel better. I'm not getting like steamed vegetables,
No, yeah, exactly.
Yeah. I'm getting some bullshit to eat.
Exactly.
It's like,
exactly. And, that's actually very common. Most people are stress eaters. I, for one reason, just lucky, I get nauseated when I'm stressed. And so the last thing I want to do is eat. And so I just will not eat when I'm stressed. Where I was the only one in residency that lost weight, everyone else was packing on the poundage.
People probably hated you for that.
They hated me for that because I'd look at them and turn away. I was very nauseous when I get stressed. So it was a benefit. But yeah, stress eating is a huge problem. And in our lifestyle in the United States, we're stressed constantly.
Yeah.
And food is so easy and the junk food is so cheap and it's so addicting. I mean, you have to think about it as an addiction more than it's like my diet.
Yeah.
And once you realize it's that kind of a battle to actually change your system over to thinking I'm going to feed my body to be the strongest possible, the healthiest possible, that's how we have to think of diet.
Well, there's also the black and white thinking too of like healthy food tastes shitty and junk food is good. And so awesome. I'm going to just be miserable. Right.
Right.
And but when in reality, like our taste buds have adapted to these hyper palatable foods. Yeah. And so we eat something normal. It doesn't taste as good at first.
Right. Well, I've noticed that since I've gone almost, completely carnivore, when I do have a piece of pie or a piece of cake or a cookie or something, it is so sweet to me. I'm amazed that I actually ate it, in the past. Where I used to, my go-to drink was classic Coke.
Oh, wow.
I love classic Coke, And when I got out of residency, I said, okay, that's the first thing to go because that's just empty carbs, And so I basically drink water almost and some coffee. And now if I have a drink of just a swig of it, it's like syrup. It's amazingly how sweet it is to me. So your taste buds change, your system changes. And then it's just like being, you're oversatiated with that. So it doesn't mean anything. So you have to get even more sweet to actually get the same rush.
Right. And this is just parallel tracks in this risky sexual behavior.
Yeah, absolutely.
It's like you need more of it. And then next thing you know, it's like you look at somebody who's like, all right, dozen donuts, just all the different things they can. And it's diminishing returns each time they eat them too.
Yeah. And then you feel worse after the fact.
Yeah. So you think for people trying to get on track with this, like, let's say, I know the experience of trying to go cold turkey off of carbohydrates. And for me, it's been disastrous. Yeah. Where worked a little better for me was maybe like, I do okay with dairy. So it was like a full fat Greek yogurt with some berries, maybe some apples and peanut butter, something like that. So I have it like I don't know, healthier sugars.
Yeah.
All of a sudden those things became to where I didn't need like 12 apples a day. Maybe it was just a couple was good.
Right. No, that's absolutely how you need to do it. Now there are some people that can do it cold turkey.
Yeah.
I mean, if you go
I'm
from
impressed.
The normal diet, American diet, and then you go keto, they talk about the keto flu, which is a real thing, know, and you feel like shit. And that's an electrolyte problem and a water problem, but and which we can mitigate that. But
which is like increasing sodium and electrolytes.
Like way more than you think.
Yeah.
I mean, like way more than you think. Rob Wolf is the keto guru out there on the web, and he's actually come up with an actual mix that you put in.
I've heard about this, yeah.
And I actually got a sample pack, and I've been trying it, and I'm surprised at how salty it tastes. I mean, it's like salty lemonade.
Okay, I'm going to give this a shot because I've been looking at it. Yeah, I took his keto masterclass and I love what I love about it is he goes out of his way to make it, take the dogma out of it.
Yeah.
Because this stuff, it
becomes a religion for some people.
It does.
This whole diet stuff, and I want it as a physician, just so you'll be healthy, so you will feel better.
Yeah.
We can body composition changing more so than just losing weight, all that kind of stuff, and I'm not one diet fits everybody. I think there's some principles, yes, that we need to do. And yes, we're fatter than all get these days. And when you lose a bunch of fat, those are givens. But how you go about it and the baby steps you need to take, that you need to take in, like your system, just slowly evolving. Like my younger brother, Matt, he's the fat one in the family.
Nice.
He's also the shortest. So my twin brother's 6'6", I'm 6 foot, Dad's 6'3". Matt is 5'6".
Oh man!
And so he's been mad since he was a kid because he got all the short genes. But and he's a computer guy and he sits at a desk all day, doing computer programming. So his whole lifestyle is set up against him being thin. Me and my twin are thin, And so, I finally prevailed on him, and he's actually, first thing he's done is he's cut out soda. There's no more pop in it. Soda pop.
Yeah.
Yeah. I don't know how you call that here in California.
I think it's soda. Yeah, we
soda?
all say soda. Midwest, I know, like Minnesota now, that is like pop.
It's pop, and in Texas, everything's Coke.
Yeah, that's a thing out here too. We get a little cross section of that. Yeah.
Okay. All right. So he's cut that out, and he's already lost 20 pounds. And he's been doing that for several months. And so what I did was I got his wife on board. so she does most of the cooking. So, she's starting changing the way they cook. And, and so it's just some baby steps, and he's just slowly moving in this direction. And eventually, I'll try to get him on keto so he can really lose weight and feel good, because he feels like crap.
That's the thing too. Like when people feel good, and then like when I'm used to getting really good sleep now and I get a bad night of sleep, and I'm like, oh my God, like I can tell the difference.
Absolutely.
When I was used to feeling like crap and eating like crap, and then it was just kind of normal.
Yeah.
Like people can kind of like get used to chronic back pain.
Yeah.
So, because our bodies really detect change, or brains detect change easier.
Yeah.
So the thing that I noticed too with eating well is that if I could take the kind of morality out of it, or the shame out of it, it helped me a lot, because if I was stressed out about what I was about to eat, then all of a sudden, like, I'm eating food in, a fight or flight state.
Right.
And my body is not really able to uptake, a lot of the nutrients.
Yeah.
Is that how it works?
Oh, absolutely. Yeah. I mean, I like the way you said taking the morality out of it, because I even noticed with myself, who I think has a fairly good relationship with food, that, I'm compliant like 99% of the time. And then one day I walk through the store and I love cinnamon rolls.
Yeah.
Homemade cinnamon rolls with all the gooey goodness on it, and I'll eat one. And to not feel guilty for doing that is a huge struggle for me.
Yeah.
And I'm trying to think in the back of my mind, why would I feel guilty for having one damn cinnamon roll?
Right.
Because it's not going to change my body fat percent one iota. I'm not going to feel like crap because I ate it,
It's not like you drove a school bus through a parking lot through with children.
I know, exactly. But we tend to, I don't know what it is about our mental, psyche that tends to do that. But I have to actually talk myself out of feeling guilty. Like, I've ruined the whole day. I might as well have, crap for the rest of the day.
Might as well go rob a bank. It gets to that point for some people.
Exactly. I know, exactly. So what was your question?
I think just in terms of like you're talking about your brother, like there's simple steps to do that have huge, returns, like high impact things, like cutting out soda. Like for me, before I really had my, major lifestyle change where I stopped drinking, using drugs, and concentrating on eating healthier foods and starting to work out and putting those pieces together. One of the first things I did was, it wasn't taking away stuff necessarily. It was just adding cucumbers into my diet. And I don't know how it happened. Maybe I was just said, we'll try these out. I think these are healthy. But I was eating cucumbers more, and something about that one change, for whatever reason, started to have. Maybe I was full because there's a lot of water in it.
Yeah.
But I noticed that I started losing weight just because of that. And it's not like a magic bullet, but just the point being that there's some things you can do, like not having these foods in the house, or getting a friend or a support system on board, or doing like one thing that's manageable instead of having to jump into the all or nothing way of doing it.
Yeah, that's a great point. In fact, my brother asked me that when we got together last time. I have my diet dialed in, I have my fitness dialed in, I have my sleep dialed in, I'm on testosterone, and he's like, well, where do I begin? And I'm like, well, as a physician, I would want to at least just see a basic. Let me just do some basic crap and just see where you are metabolically, But if you don't have time to do that, I said, just do one thing, cut out sodas, and then see how you do. Then just start a simple exercise program. Get off your butt and go walk, a couple miles each day. Even if you only do 10 or 15 minutes of exercise each day, you can do that. And then the other thing I wanted to do was, I have an app called MyFitnessPal.
Yeah, that's a good one.
Because most of us do not realize how much shit we actually eat.
Yeah.
So that's why I stress with all the guys that come into the clinic. I said, okay, you're going to get this app, and everything that passes between your lips, you're going to put down on this. And it is an eye-opener.
Yeah.
how much crap and how often we're eating crap.
I noticed that, maybe I'm actually eating like 7 or 8 spoonfuls of like peanut butter. And I'm talking about like big old, like fucking
Exactly.
diggers in there. And I was like, that was 800, 900 calories. Easy.
Yeah. And if you're on a, 12 to 1500 calorie a day, that's basically your meal.
I know. Then you feel ripped off.
Exactly. And then other days, even now I've been doing it for so long, I'll be surprised. Like I'll look at my number of, I have, and I'm like, man, I've only eaten like 500 calories today. I need to start eating. And other days I'm like, man, I'm starving. I'm like, I only have 200 left.
Yeah.
So but that at least it helps you keep track of stuff. So just some simple things where, change gets rid of crap in your house. So when you have a moment of weakness, it's just not there and you can't eat it.
That's it. Yeah, exactly.
It's a big deal. Then just a simple exercise program that you can incorporate that do something every day.
And that's the thing. It's, I see people, when I'm working with them as their counselor, their therapist, this urgency to want to fix everything right now.
Right.
Because it's uncomfortable once you look at maybe how much of a problem things are. Yeah. That it's like, let's just get it all out of the way now. That kind of like magic bullet, kind of the magic pill kind of like mentality. Yeah. Yeah. And it's saying like, okay, before you say, I want to get it in shape, so let's sign up for an Ironman. How about we just start walking around the block a little bit?
Exactly.
Right?
Exactly.
I know. I want to get successful. Which medical school? Let's go to community college and take a class first, right?
Yeah. Take organic chemistry and see how you do. Yeah. I mean, it's setting expectations.
Yes.
And a lot of guys, I'll just ask them this simple question: how long did it take you to get this fat?
Right.
Like either come in their middle age or whatever, in their high school. I said, what did you weigh in high school? So the last 20 years, it's taking you 20 years to get to be morbidly obese. Okay. You're not going to lose it all by tomorrow. Trying to help them actually get some perspective on their health, Yeah. Now, this is how we're going to do it. So when guys come in to see me in clinic, I talk to them and I do the physical and then we send off a bunch of labs. And once the labs come back in, then they come back and visit. And that's the long visit because that's when this is your state of health. Yeah. And I go through everything. And then this is our goal.
So you tell them, have a seat.
Have a seat. Exactly. I don't need to see them in an exam room. We sit in a little conference room.
Yeah.
And let's talk about your health, your metabolic profile, but then, I said, and this is our goal. And these are the steps we're going to take to get there. So there's a plan in their head, everything that I've got their back, medically, and we got a plan for them nutritionally, and we have a plan for them in fitness wise that fits in their lifestyle. And then if I need to put them on testosterone, whatever, I'll do that. And then I'm going to see them regularly and we're going to track their progress. And so a lot of them, feel guilty. Man, I haven't lost any weight. I'm going to see Dr. Lunow next week,
Yeah.
So getting all nervous, and, but we need that. We need someone to keep pushing us.
That's true. You surround yourself with people who are going to help you get out of that rut and encourage you to do it. That it's interesting. And that's why, I realized I really can't stand kind of like the shows like the Biggest Loser, or where they try to stress people out, out of being fat when they're just jacking them up and saying like, all you have to do is just work out more and eat more ice cubes. And and these people are exhausted. They want to eat a lot because they've exercised as much and stressed their body out and haven't recovered. And they're like, I can do this easily is if I just go balls to the wall for, a couple months.
Right. But that's completely not sustainable.
Yeah.
You can't do that for life. And then you've seen the shows that have seen these people that had lost a bunch of weight. They almost all have regained it.
Yeah, just about all.
Yeah, because they're doing it for a show. They weren't slowly changing their lifestyle, changing their mental mindset, which is a huge part of it, and making it a lifestyle change. Because it has to be a lifestyle, otherwise forget it. If you're not mentally and you're going to make the lifestyle change, what involves all these components, then there's no point in me just, giving it testosterone or whatever. Or you just cutting out sodas or whatever. You have to buy into it for your own health's sake. And my struggle has been how can I make them feel better faster so that they'll buy in and stay in?
Yeah, exactly.
And buy into the program, and that's a little bit of a conundrum from me and
shifting the mindset to a long-term thinking. Yeah. I'm laughing because I'm remembering. So when my wife, when we were just dating, she'd fly out to North Carolina to see me. And if I had been working out as much as I wanted to, and I wanted to impress her, I'd show up early and just do a bunch of push-ups and try to like
Be pumped?
Yeah, exactly. Get pumped. So I'm looking more impressed. It's the short-term mindset thing.
Exactly. Well, my business partner Corey and I, he's more of a power lifter, and he's big. He's much bigger than I am. But I was telling Corey, I said, if we're gonna promote this, we have to be the best examples of this.
You're right.
And show everybody.
Lead from the front.
Yeah, lead from the front. That you can do it. I can do it. I'm 56 now. And I don't know, Corey's 38, I think. That I don't care what age you are. Someone my age needs to be much more rigid about it. Little indiscretions go a long way. The older you get, the younger, healthier guys can have more indiscretions. But if you really want to get healthy, you have to buy into the program, and you have to realize this is my whole life here, and I want to be as healthy as possible, as long as possible. So you can be this healthy into your 80s, and I can stave off all these diseases, but you have to buy into the program.
Yeah, you have to have that intrinsic motivation, that the why, like why you're doing it.
Yeah.
If it's just to impress a girl, it's not going to last as long. If you're doing it for yourself, to prove yourself you can be healthy, that's going to get you a little further. But it seems like the most powerful reasons are if you have someone else in mind, like it's going to be of service to someone else. Like for me, if I can be an example to my kids,
exactly.
Or if I can be an example to like other vets, it really helps me say, okay, this is more important than just myself. So
yeah, absolutely. But yeah, internal motivation is hard. I mean, I can help you with everything else. But your reason, your why for doing it, and we can talk about it, but it has to be something that's pertinent to you and something that motivates you. And that'll be different for everybody else.
Perfect. Well, I think that's a good note to go out on. What else can we add to it?
Well, we've talked about a whole host of things.
Yeah. Well, I think we're going to have we'll probably break this up into a couple parts, but
okay.
We'll see what the feedback is from people listening. And I think we will connect a few more times to really go into depth in some of this, because we condensed a lot of things into a couple hours here.
We did. Yeah. There's a lot of things that need to actually be more fleshed out for sure. I think the guys in the whole sexual side of things obviously need to be talked about more, and how what's happening and why, and how to process that, and how to actually mitigate that. And that's not something we talked about. We just talked about the fact that it exists. Health and nutrition, the diet kind of thing, that could be another whole discussion as well. We're going to get more into the biochemistry and actually what's happening and why certain things would be better for you versus you, and why like one diet doesn't fit all.
Yeah. I think that's a great way to go. So, hey man, I appreciate you flying all the way out here from Texas, halfway across the country to meet and be on this podcast.
Absolutely. It's been my pleasure, Mike. It's great to meet you, and thank you for the invite.
Awesome. Right on. Hope you guys enjoyed that. That was Dr. David Lunow of Apex Health. All right, everyone, go ahead, subscribe to this podcast. Just click. Go ahead right now. Just while you're sitting around, go ahead and click subscribe. Thanks to you who did that. Appreciate it, man. Leave a review, even if it's just, hey, this podcast sucks, or I like it, it's cool. Something simple, man. You don't have to write a novel. This helps us to get up in the ratings. I don't even understand how that works. I just hear other people say it on their podcast, so I know it's true, right? You do that, tell a friend about it, share an episode. There's that little button where you can share it and, just text it to one of your friends, email it to somebody. Maybe someone needs to hear about what's going on with Dr. Lunow and maybe even become a patient of his and get their life and their health back on track. All right, everybody. Thanks for listening, as always. And remember, until then, drink water, meditate, kill bodies. Yut.